You know what? The monsoons are very unique to the subcontinent, and as South Indians, let me take credit that the first drops are actually felt in Kerala, and it is then that the rains actually take over the rest of India. So, the rains start in South India. But let's also be honest here. With the monsoons, there are multiple problems faced by all of us, like excessive water on roads, landslides in the mountains, flooded homes, and what is worse, seasonal diseases, which make the rains actually a debilitating experience. It's all very well to be romantic about it, but people who suffer really suffer. We are going to talk about that one viral fever which takes over us year after year after year. Did you know when did India first come under the grip of dengue? It's on your screens right now. As to when did the first case, it was 1780, first case of clinical dengue-like illness was recorded in Chennai, then called, of course, Madras. 1963 to 64, first virologically proved epidemic occurred in Kolkata and the eastern coast in India between the years 1963 and 1964. And you know what? Many of us will remember the recent outbreak, which was in the year 1996. When I say recent, most of us were adults at that time. An outbreak of dengue hemorrhagic fever or dengue shock syndrome, which is called DSS, occurred in 1996 in India near Delhi. The cause was confirmed as dengue virus type 2. This is the largest such outbreak which was reported from India, indicating a serious resurgence of dengue virus infection. And you know what? And thereafter, year after year, we have witnessed a surge in dengue. For instance, in 2006, you will see it on your screen how the dengue fever actually took over so many people and so many states all over India. Nearly 90 plus dengue cases were reported daily, totaling 2,728 cases. I mean, that is something. The cases doubled from 50 to 60 every day, ladies and gentlemen, to almost 100. Over 10,000 patients presented with fever during the outbreak. 72 critically ill cases were referred to the AIIMS ICU. Those statistics to show you the history of dengue, as it were, a fever which takes over year after year, and a lot of people suffer. They dread the rains and they just cannot fathom what else can they do to be away from this terrible, debilitating fever. Today we shall take a close look at Bengaluru, the IT hub of India, a state capital which drowns every time there are rains. Bengaluru, which is now administered by a new government. Now brace yourselves, ladies and gentlemen, for I don't even for a moment intend to create panic at all. But in the month of July alone, it witnessed a sharp rise in dengue cases in Bengaluru. From early to end July, Bengaluru saw a rise of 140% increase in dengue cases. Of the 4,739 dengue cases reported from Karnataka, Bengaluru alone accounted for 2,502 cases, which is actually in percentage form around 55%. So, let us try and look at all the aspects of this terrible seasonal which occurs primarily during the rainy season, figure out what is it, why is it, and how is it that you and I, all of us, can actually look at it from a very holistic point of view and see to it that we don't fall into the grips of dengue. Dr. G.V. Basavaraja, you are here with us, and thank you very much for joining us. Tell me something, is it true that, because I do not know, you have to explode this myth. Today, I think all of us should also explode some myths about dengue. Is it true that more and more kids get impacted by this, doctor?
Talk about a dengue infection, it affects not only the adults, it also affects the kids as well as a newborn. The moment we say newborn is even it is a less than 30 days. It can affect cutting across all the age group. That is the one of the thing. When you talk about the dengue, two things we need to remember. This is the one is it is a dynamic disease. That means the clinical symptoms changes very rapidly. And two, it is a deadly disease. Means so some of the complications which can occur with the dengue, that especially when you are occurring in a pediatric age group, that is less than 18 years, especially less than 1 year, and adolescents between the 11 to 19 years. These are the two age group where the complications will be more prevalent as compared to the other age group. So it is yes, dengue cases which were not much in the 2021 and 2022 and 20. Main reason is because the social mobilization of the population which was not there. Now the lot of things has been normalized following in a post-COVID thing. So now the cases of dengue started occurring even in a pediatric age group also.
Right. I think we are now joined by the other two guests as well. D. Randeep, who is the Commissioner for Health and Family Welfare Karnataka, is also joined us, and also Dr. Pratyush Miglani, who is Specialist Internal Medicine, Sagar Hospital, Jayanagar. A very warm welcome to both of you. I would first like to ask, Mr. Randeep. Mr. Randeep, why is it that there has been such a sharp increase this year? 140%. I'm not saying that, one is focusing on Bengaluru because it is the IT hub. It is one of the most modern cities in the south of India. I'm not saying others are not, but Bengaluru has a cross section of people. It is the melting pot. The kind of we see not just IT, but industries are very, very vibrant there. What do you think is the reason for such a sharp increase, Randeep ji?
Yeah, thank you for having me and raising this important subject. Dengue has been with us. I mean, it's not new to Bangalore. It's not new to Karnataka. We've been having cases. But yes, you are right that this year the rise has been much higher than what we have seen last year. I can say at least 25% to 30% higher cases are observed in Bangalore this year. And these have multiple reasons. It's not just only on account of the intermittent rains that we are seeing in Bangalore, which is leading to kind of the small water spots being formed, stagnant water spots, which is leading to the breeding of Aedes mosquito and leading to the morning bites. Apart from this, what Bangalore has seen is a proliferation of these construction sites. And our teams do tell us that when they actually go out into the field and kind of check on the ground, maximum breeding points are found in these areas. And this is the East Bangalore, Mahadevpura, and also the South zone of Bangalore. We do see a lot more of these cases. So there are multiple reasons: construction sites, intermittent rains, people storing water in their houses. For if water is not supplied for a long time, people tend to store water in their houses. And any storage of water beyond, say, 2-3 days, one does find the growth of these breeding of these mosquitoes. So people need to be aware, and people need to ensure that these source points are reduced and eliminated. Only then we would see some kind of a reduction in the cases.
Right. Dr. Miglani, I want to ask you that, all of us have gone through COVID, so there is a bit of neurosis and paranoia as well. Conjunctivitis cases are increasing in New Delhi. Everybody you see is wearing dark glasses. And, the thing is they are saying it's very virulent. Some of them say, I do not know whether, one can prove it medically, but this is what they are saying. 4 दिन की बजाय 7-7, 8-8 दिन है अब हम लोगों को. So it is also part of, maybe it's psychosomatic. I'm not a doctor. I do not know. But we lived through COVID. So today when I said I'm going to discuss dengue, they all said please do, because Delhi is also presenting itself with cases. But today our focus is on Bengaluru, 140% increase. Randeep ji was very kind to explain what is the reason. I'm asking you, how come during COVID time dengue was almost eclipsed? Was it because we had a larger problem staring at us, or we actually presented with less dengue cases, sir?
Hi, thanks for having me.
Pleasure.
The reason, as mentioned earlier, is that the social gatherings, everything is coming back to normal. And with the more of people, the more contact, the mosquito bites and the incidents. What you said is true. It's not like that we didn't have the cases during the COVID pandemic. We did have dengue cases, but they were less pronounced in number and severity. As the reason mentioned by Honorable Health Commissioner here, so the water logging, and this time the rains are intermittent, so it lets the water stagnate more often and more commonly. The disinfection drive by the civic authority and awareness is on the rise, but the cases are substantial this time, what we have seen. And as usual with dengue, Dr. Baswaraj also mentioned, all age groups are susceptible. It is the reason is the bite of the female mosquito. And there are certain groups of people who are at higher risk. So they tend to show the severe form of the disease, and that is what requires. It is high risk, can lead to worse complications and even worse outcomes.
Right. Sandeep, let me, I thought I should have you because you represent all of us, citizens, people, and I want to ask you that, it's not just Bengaluru. Bengaluru is the context, Sandeep, but then it involves every city. Why is it year after year after year? I mean, this is rather sad, isn't it, that we have to brace ourselves. Season, July, rain, dengue, malaria, encephalitis, these kind of disease. This time Bengaluru, is particularly, I have been speaking to several people and they say it's really scary. So what do you think is the reason? Not medical, but other civic reasons, as it were.
Sudha, thanks for having me on the show. Sudha, firstly, we need to understand the genesis of dengue as a disease, and after that, I will give some suggestions on policy level. But firstly, the particular mosquito that causes dengue has very interesting characteristics. One, it prefers fresh water. It's a very hygienic mosquito. It does not prefer drainages or stagnant sewer water. It likes fresh water. Second, it has a very low radius of operation. From birth to death, it doesn't travel much. It's not very migratory. So if a mosquito that causes dengue bites you, it has bred and lived in your immediate vicinity. So it could possibly be your house, it could be your balcony, it could be the garden, not beyond that. Or if there are some sites nearby, like construction sites, as Mr. Randeep said, or it could also be waste. Wherever there's a lot of accumulated waste, there will be paper cups, plates, and things like that, which will collect very little fresh water during the rain. And that's enough for this mosquito to breed. This is what needs to be understood. So it's very highly localized and it prefers fresh water. And the third thing to remember is it's a day bite mosquito. It's not a night bite. So it's not your typical mosquitoes who come awake in the dark and bite you that cause dengue. It is the mosquitoes that bite you during the day, in the afternoon, the evening, and it's very low flying. It travels close to the ground and it bites you in your legs. So if you understand these four characteristics, you can also understand how to prevent it. So first thing is we have to prevent any kind of stagnation of fresh water, clean water nearby your house and around your house. So what are these? If you have garden pots, you have to check in the pots if there's water stagnating, in the gardens if the water is stagnating, or in slums, people collect water in drums and store them. They have to be kept covered and they have to be checked for larval growth and cleaned and purified occasionally. This is how you can prevent it. The second thing is waste collection. I think the waste, there is more than health department, is the waste what do you call that? The waste collection wing of the BBMP, which has to be more careful here. They have to ensure that none of the waste accumulates for long periods. They have to clear it away very fast and have to get it processed very fast. So this is where the corporations of the cities can play a role, that they don't allow any stagnation anywhere of fresh water.
Right.
The third thing is policy level. Now you see our state apparatus of disease control and health is completely obsessed with COVID. Even now you see every day they have COVID circulars, they are collecting COVID data and all that. If you ask me, it's a personal opinion, I feel COVID itself was a false flag because it was just a virus disease which came and went and people developed herd immunity and that was the end of it. But we somehow are so obsessed with it, we are we are committing too much resources to that. It's a dead disease. Nobody is dying of COVID anymore. It's just like another flu. It's
Right.
like a cold that comes and
Okay.
goes. The state should, in this case, dengue itself, what? The only prevention you can do is to help people have awareness. Now, the very simple facts that I mentioned to you is not aware, it's not there in popular awareness anywhere. So the state health departments have to commit its resources to spreading education on how to prevent dengue. It's such simple facts that people have to know.
Right. Okay.
And I think Mr. Randeep will agree with me on running campaigns for educating citizens and also the state administrations on how simple it is to actually prevent dengue
Right.
and to ensure that it doesn't affect people.